Okay, are you ready to dive into the world of your genitourinary system?
Let's go.
Whether you're studying healthcare or just curious about how your body works, this deep dive is for you.
It's going to be fascinating.
We're taking a nursing lecture and uncovering everything you need to know about UTIs,
Kidney stones.
even STIs.
You might even learn a DIY kidney check you can try at home.
I love those.
It's incredible how much the system affects our overall well-being, not just bathroom functions.
It's so true. It all connects, right?
Absolutely.
So for starters, remind me what those ureters are up to.
Well, think of them like tiny, powerful tubes about 10 inches long.
10 inches. Wow.
Yeah, and they use peristalsis, a wave-like motion, to move urine from your kidneys to your bladder.
Makes sense.
But here's the interesting part. They're surrounded by nerves and blood vessels.
Ah, that explains why passing a kidney stone can be so painful.
Exactly. It's like a tiny rock trying to squeeze through a very sensitive area.
Ouch.
Then we have the bladder, which is surprisingly spacious. It can hold up to a liter of urine.
A whole liter. Seriously.
Yep. But of course, we get the urge to go way before it gets that full.
Yeah, usually around 200 to 250 milliliters for me.
Same here.
So tell me about the urethra.
Well, the urethra is that tube carrying urine out of the body.
Right, yeah.
And it actually has these internal and external sphincters, which are like rings of muscle acting like valves to control urine flow.
Oh, so that's how it prevents leaks.
Precisely. They're like little gatekeepers.
I like that analogy. Now, I heard there's a cool technique you can try at home to check for kidney inflammation.
Yes, the costovertebral angle tenderness assessment.
Okay, what is that?
You gently tap on your back where your ribs meet your spine.
Okay, yeah.
A dull thud is normal, but sharp pain could mean kidney inflammation.
Interesting. I'm going to try that later.
You should.
Now, let's talk about those UTIs that seem to plague everyone at some point.
Oh, UTIs, so incredibly common, especially in women.
Tell me about it.
And while many are simple to treat, some can get a bit complex.
So walk me through this. What's the difference between an uncomplicated and a complicated UTI?
An uncomplicated one occurs in a healthy urinary tract, no blockages, and usually responds well to antibiotics.
Makes sense.
But a complicated UTI, those involve things like obstructions, maybe kidney stones, catheters, or underlying conditions like diabetes.
So those are the tougher ones to deal with.
Exactly. And you know the usual suspect behind most of these?
Oh, tell me.
E. coli.
E. coli. Isn't that in our gut?
Yes, but it can sometimes travel to the urinary tract, causing an infection.
Sneaky little bugger.
I know, right?
So how does it even get into the urinary tract?
Think of it this way. The bacteria, especially E. coli, manage to sneak their way into the urinary tract, usually up the urethra.
Oh, no.
And once they're in, they can multiply and set up shop.
Leading to an infection.
Right.
So is it true that holding your pee for too long increases your risk?
Absolutely. When urine sits in the bladder, it creates a perfect breeding ground for bacteria.
So regular bathroom breaks are key. What else can increase the risk of those bacterial invasions?
Well, things like tumors or even pregnancy can obstruct the urinary tract, causing urine to back up.
And that creates that stagnant environment we talked
Yeah,
about.
exactly.
Okay, so blockages are bad news.
They really are.
Anything else to watch out for?
Catheters and stents, although sometimes medically necessary, can unfortunately act as a pathway for bacteria to enter.
Oh, right.
And anatomical issues, a weak immune system, even constipation can increase your risk.
Wow, I didn't realize there were so many factors.
It's a complex system.
So how do we know if we've got a garden variety, uncomplicated lower UTI? What are the signs?
The classic signs are hard to miss. Painful urination.
Ugh, the worst.
That constant feeling of needing to pee, even some dribbling after you think you're done.
Been there.
And you might notice your urine looks cloudy or smells a bit off.
Got it. Now, do older adults experience the same symptoms?
Not always. They might have more general abdominal discomfort, maybe even sudden confusion.
Oh, wow. So any unusual changes in their behavior could be a sign.
It's worth considering a UTI for sure.
Good to know. So how do doctors diagnose these lower UTIs?
Usually it starts with a simple urinalysis.
To check for white blood cells and bacteria.
Exactly. Then a urine culture helps identify the specific bacteria causing the infection.
So they know which antibiotic will work best.
Precisely.
Okay, makes sense. What's the treatment plan once a UTI is confirmed?
The goal is to knock out those bacteria. Antibiotics are the go-to.
I figured as much.
Doctors often start with a broad-spectrum antibiotic until the urine culture results come back.
Makes sense to cover all the bases. And of course, staying hydrated is always a good idea.
Absolutely. Drinking lots of fluids, ideally around 2 liters a day, helps flush out those bacteria.
2 liters noted. Anything else?
Avoiding things that irritate the bladder, like caffeine or alcohol.
Good advice.
And a heating pad on your lower abdomen can help with pain.
Those are lifesavers. Now let's talk about those upper UTIs, the acute pyelonephritis.
Ah,
How are those different?
it's essentially an inflammation of the renal pelvis, which is part of the kidney.
Oh, wow.
It's usually caused by a lower UTI that's traveled upward. Obstructions or anatomical issues can also be a factor.
So, like a UTI on steroids?
You could say that.
What are the symptoms?
You'll have the usual lower UTI symptoms, but also fatigue, chills, fever, nausea, vomiting,
Oh, dear.
and flank pain.
Philco pain.
That's pain in your back, right around your kidney area.
Okay, got it. And older adults.
Again, their symptoms might be less obvious. They might have a lower fever or even a slight decrease in body temperature.
So it's really important to pay attention to any changes in older adults.
Absolutely.
How is acute pyelonephritis diagnosed?
The process is similar to lower UTIs. A urinalysis will usually show signs of infection, and a urine culture helps guide antibiotic treatment.
Okay, so same tests, but different treatment.
The treatment is similar, but usually more aggressive since it's reached the kidneys. Intravenous antibiotics are often the first line of defense.
So a hospital stay might be necessary.
It depends on the severity and the person's overall health.
Makes sense.
Once the infection starts to improve, you'll usually switch to oral antibiotics.
Got it. And I'm guessing hydration is still super important here.
It's crucial both for treatment and prevention. It helps flush those bacteria out.
Seriously, I need to drink more water.
It's so important.
Before we move on, let's talk about preventing UTIs in the first place. What can we do?
There are a lot of simple things you can do. First, if you're prescribed antibiotics, finish the entire course.
Even if I start feeling better.
Yes, even then, stopping early can allow some bacteria to survive and become resistant.
Oh, so that's why it's so important.
Exactly. Okay, what else? Basic hygiene goes a long way. Cleanse the genital area gently. And for women, wiping from front to back is key.
Good reminder.
Empty your bladder before and after intercourse, too.
Why is that?
Well, during intercourse, bacteria can be pushed toward the urethra.
Ah, so emptying your bladder beforehand helps flush out any bacteria that might be there.
Exactly.
That makes sense. What else?
Pee every 2 to 4 hours. Holding it in allows bacteria to multiply.
Even when I'm busy, I gotta go.
Got it. And drink plenty of water throughout the day.
Okay, that's 2 votes for hydration.
It's so crucial. It dilutes your urine and makes it less hospitable to bacteria.
Makes sense. Anything else?
Avoid harsh soaps, bubble baths, powders, or sprays in the genital area. They can disrupt your natural bacterial balance.
So, be kind to our nether regions.
Got it. And of course, if any UTI symptoms show up, see a doctor right away.
Absolutely. Early treatment is always the best approach.
Now let's talk about urinary obstructions. What causes them?
Well, obstructions happen when something blocks urine flow. It can occur anywhere along the urinary tract.
Like a traffic jam in your urinary system.
Exactly. And these traffic jams can be caused by kidney stones, tumors, scar tissue, even anatomical abnormalities.
So anything blocking the road, so to speak.
We mentioned kidney stones earlier. What are they and why are they so painful?
They're hard deposits that form inside the kidneys from substances in the urine.
Hard deposits, like little rocks.
Yeah, basically tiny, jagged rocks that can get stuck in the urinary tract.
Ouch.
And as they try to pass, they cause that excruciating pain.
I can only imagine.
The severity of the pain depends on the size and location of the stone. And, kidney stones affect about 10% of Canadians.
That many.
And here's the kicker. They have a 50% recurrence rate.
So if you've had one, chances are you might get another.
It's highly possible.
Not good odds. What causes them to form in the first place?
It's a mix of genetics, diet, and lifestyle. Things like high levels of calcium, oxalate, or uric acid in your urine can increase the risk.
Okay. What about lifestyle factors?
Anything that makes you sweat a lot. Saunas, hot yoga, intense exercise, or even living in a warm climate.
Why is that?
When you sweat a lot, you produce less urine, making those stone-forming substances more concentrated.
Ah, so they're more likely to crystallize and form stones.
Exactly.
And I've heard that certain foods can increase your risk too.
Definitely. Foods high in oxalate like spinach, berries, and even dark chocolate can contribute to calcium oxalate stones, which are the most common type.
No more chocolate.
Moderation is key. A diet high in protein or sodium can also up your risk.
Okay, got it.
And alcohol can dehydrate you, messing with your body's balance and making stones more likely.
Moderation is key, I hear you.
And of course, not drinking enough fluids is a major risk factor.
Okay, enough about dehydration. I'm going to go fill up my water bottle.
Good idea.
You mentioned calcium oxalate stones being the most common. Are there other types?
Yes, there are a few others. Calcium phosphate stones, often found with other types. Struvite stones, usually a result of UTIs.
More common in women.
Yes, they are.
Okay, what else?
Uric acid stones, more common in men, often linked to gout.
Right.
And finally, cystine stones, which are quite rare and caused by a genetic defect.
So many different kinds.
Each with its own quirks.
Speaking of quirks, let's talk about the dreaded kidney stone attack. What does that feel like?
It's not a pleasant experience. Imagine sharp, excruciating pain in your abdomen or flank, usually on one side.
I'm wincing just thinking about it.
It's called renal colic. It's caused by the stone blocking urine flow.
Ouch.
Along with the pain, you might experience restlessness, nausea, vomiting, blood in your urine, and even symptoms of shock.
Sounds awful.
Yeah.
What about someone who has a UTI at the same time?
A double whammy. They might also experience fever, chills, and burning when urinating.
Oh, no.
It's not fun.
How do doctors diagnose kidney stones?
A urinalysis and urine culture can check for infection, but imaging tests are key to actually see the stones.
To see their size and location.
Exactly.
What kind of imaging tests?
An intravenous pyelogram is common, using contrast dye to highlight the urinary tract. Ultrasound and CT scans can also pinpoint those stones.
So once a kidney stone is diagnosed, what's the next step? How do you get rid of it?
The first priority is managing that pain. Pain meds and IV fluids are usually given to help flush the system and encourage the stone to pass naturally.
Okay. And what about lithotripsy?
You're right. Lithotripsy uses shock waves to break the stone into smaller, passable pieces.
Like blasting those stones to bits.
Exactly. Sometimes a stent is inserted to keep the ureter open and help those fragments pass.
Makes sense. Are there other procedures if the stone is stubborn?
Yes, for larger or stubborn stones, there's percutaneous nephrolithotomy.
What's that?
It's a minimally invasive procedure where a small incision is made in your back, and a nephroscope is used to remove the stone directly.
Okay, so a bit more direct. What about recovery after these procedures? Any complications?
Well, as with any procedure, there are risks.
Like?
One long-term issue could be urinary retention, where your bladder struggles to empty fully.
Usually due to a blockage, I'm guessing.
Yes, and if an infection develops, it can lead to something called obstructive pyelonephritis.
Wow, so it's not always smooth sailing. But I imagine preventing kidney stones in the first place is the best approach.
Prevention is key. It all starts with, you guessed it, hydration.
I knew you were going to say that.
At least 2 liters of fluid a day, unless your doctor says otherwise.
2 liters. Got it.
And staying active helps too.
Those bathroom breaks again.
Exactly.
What about diet? Any specific changes that can help?
Absolutely. Avoiding those oxalate-rich foods we talked about can be helpful.
Like spinach, chocolate, and berries.
Exactly. But here's a tip. Eating calcium-rich foods alongside oxalate-rich foods is a good strategy.
Why is that?
The calcium binds to the oxalate in your gut, preventing it from being absorbed into your kidneys.
Oh, interesting. So it's not about avoiding calcium altogether.
Right. It's about smart consumption.
Got it.
Limiting purine-rich foods and alcohol can also help reduce uric acid and the risk of those types of stones.
So much good information.
It's all about making informed choices.
Now let's talk about benign prostatic hyperplasia, or BPH.
A mouthful, right?
It is. What exactly is BPH?
It's a very common condition involving an enlarged prostate gland.
And it affects mostly men.
Yes, it affects a large percentage of men as they age, about 10% by age 40 and a whopping 50% by age 60.
Those numbers are significant. But the good news is it's benign, right?
That's right. It's not cancerous, but it can definitely cause some uncomfortable urinary problems.
So what causes the prostate to enlarge? Is it just part of aging?
While it's more common with age, it's not inevitable. The main culprit is hormonal changes. As men age, testosterone levels decline, but a hormone called DHT can actually increase.
DHT. What's that got to do with the prostate?
DHT specifically encourages prostate cell growth. Too much DHT can lead to an overgrowth of prostate tissue, causing it to enlarge.
And press on the urethra.
Exactly. That's when the problem starts.
It's like squeezing a garden hose.
A perfect analogy. And this obstruction leads to those annoying urinary symptoms.
Annoying and embarrassing sometimes.
You're right. The symptoms can be quite bothersome. That's right. The symptoms can be quite bothersome.
So let's talk about those symptoms. What should men be on the lookout for?
The most common symptoms fall into 2 categories: Obstructive and irritative.
Okay, I'm listening.
Obstructive symptoms are related to that blockage of urine flow. So, things like a weak urinary stream, difficulty starting, hesitancy, a feeling of not fully emptying, even dribbling at the end.
Makes sense. It's like your bladder is working overtime, but the urine is hitting a roadblock.
Exactly. And then you have the irritative symptoms.
Those are the ones where the bladder's freaking out.
Basically, think increased frequency, urgency, that sudden gotta-go feeling, and maybe pain or burning during urination.
Ouch.
Some men experience bladder spasms, frequent nighttime urination, or even incontinence.
So it's like the bladder is sending out distress signals.
A great way to put it. Now, how do doctors diagnose BPH?
That's a good question.
Usually it starts with a physical exam.
What do they look for?
A doctor might feel an enlarged prostate during a digital rectal exam.
I'm guessing that's not the most fun exam to have.
You're right, not the most pleasant, but it can help assess the size and shape of the prostate.
Okay, so what else?
A blood test for prostate-specific antigen, or PSA, is often done.
I've heard of those. What do they tell us?
PSA is a protein made by the prostate, and high PSA levels can sometimes point to a prostate problem.
Oh, yeah, right.
But it's important to remember that PSA can also be high with prostate cancer.
Ah, so more tests might be needed to rule that out.
Exactly. A PSA test alone isn't enough for a BPH diagnosis, but it can raise a red flag.
Got it. What other tests might be done?
A urinalysis to check for infection, a urine flow study to measure the speed and volume of urine flow, and a bladder scan to see how much urine is left after you pee.
So it's a multi-pronged approach.
It is.
Now let's talk about treatment. What options are available for men with BPH?
Well, the treatment really depends on how severe the symptoms are and how they're impacting a man's life.
Makes sense.
For mild cases, a wait-and-see approach called watchful waiting might be recommended.
So basically monitoring to see if things get worse.
Exactly. But if symptoms are already causing problems or watchful waiting isn't appropriate, there are other options.
Okay, like what?
Lifestyle modifications, medications, and minimally invasive procedures.
Let's start with lifestyle changes. What can men do naturally?
Simple things like cutting back on caffeine and alcohol, those can irritate the bladder.
Right.
Avoiding meds that worsen symptoms, like decongestants or antihistamines.
Okay.
Maybe restricting fluids in the evening to minimize those nighttime trips to the bathroom.
Ah, good strategy.
And some men find timed voiding helpful.
Timed voiding. What's that?
Training yourself to go at regular intervals, even if you don't feel the urge.
Interesting. Like retraining your bladder.
Exactly.
What about medications?
Two main types are used for BPH. 5-alpha reductase inhibitors and alpha blockers.
Break those down for me.
5-alpha reductase inhibitors, like finasteride and dutasteride, work by blocking testosterone from turning into DHT.
Ah, that hormone that stimulates prostate growth.
Exactly. They basically help shrink the prostate.
Makes sense.
Now, alpha blockers, like tamsulosin and alfusosin, work a bit differently.
Okay, how so?
They relax the muscles in the prostate and bladder neck, making it easier for urine to flow.
So not shrinking the prostate, but easing the pressure.
Precisely.
So which one is better?
It really depends on the individual and their symptoms. Sometimes a combination is the best approach.
Okay, makes sense. But what if medications aren't enough?
If they don't provide enough relief, or if there are complications like recurrent UTIs or bladder stones, surgery might be recommended.
What kind of surgery?
The most common is a transurethral resection of the prostate, or TURP.
TURP, okay. What is that?
It's less scary than it sounds. The transurethral part means the surgery is done through the urethra.
So no big incisions.
Exactly. A special instrument called a resectoscope is used to remove excess prostate tissue.
How does that work?
It has a tiny loop that uses heat to remove the tissue that's blocking the urethra.
So they're basically shaving away the extra tissue from the inside.
Precisely.
What about recovery after a TUR?
You'll have some pain and discomfort, so pain meds are usually given.
Right.
A catheter will be inserted to drain urine, might stay in for a few days. And sometimes continuous bladder irrigation, or CBI, is used.
CBI, what's that?
It's a continuous flow of sterile fluid into the bladder, helping to flush out blood clots and debris and prevent blockages.
So it's like a rinse cycle for the bladder.
Exactly.
What should men be aware of when they have CBI?
The key thing is to make sure more fluid is coming out than going in.
Okay, so it's all about maintaining that balance.
Exactly. And everything needs to be kept sterile to prevent infection. The color of the drainage is also important.
What should it look like?
It might be bright red at first, but it should gradually become light pink. If it stays bright red or has lots of clots, that's a red flag.
Okay, so it's a carefully monitored process.
Yeah.
Got it. Let's shift gears to urinary retention and incontinence. They seem like opposites, right?
They are. One is about holding it in too much. The other is, well, the opposite.
And both can be problematic.
Absolutely. Urinary retention is the inability to empty your bladder completely. Incontinence is the accidental leakage of urine.
Okay, got it.
And retention can be acute, meaning sudden, or chronic, meaning ongoing.
And acute urinary retention is a medical emergency, right?
You bet. If you suddenly can't urinate, get medical help immediately. It could be a serious blockage.
So don't wait on that one. What about chronic retention?
Chronic retention means incomplete emptying, even though you might still be able to urinate.
So you always feel like you have to go, but never quite get that relief.
Exactly.
What causes these types of retention?
Obstructions are a common cause.
Hmm.
An enlarged prostate, tumors, scar tissue, kidney stones.
Okay.
But retention can also be caused by a weak bladder muscle, which can happen from nerve damage from things like diabetes, stroke, or multiple sclerosis.
So lots of different reasons.
And even some medications can contribute.
Okay, so how do they diagnose what's going on?
A detailed medical history and physical exam are the first steps.
Makes sense.
Avoiding diary can also be helpful. You track your fluid intake, urination frequency, and any difficulties.
So it's like a food journal, but for pee.
Exactly.
Clever.
A urinalysis is often done to rule out infection, and a key test is measuring how much urine is left in the bladder after you urinate.
That's the post-void residual volume, right?
Yes,
Okay.
exactly. It tells us if you're fully emptying your bladder.
How do they measure that?
They can use a bladder scanner, a non-invasive ultrasound device,
Hmm.
or a straight catheter can be inserted to drain any remaining urine and measure it.
A couple of different ways to get that information.
Right.
And treatment for urinary retention. Is it different depending on the cause?
Absolutely. If it's an obstruction, the priority is to remove or reduce the blockage.
Okay, and if it's not an obstruction,
Medications that relax the bladder and prostate muscles can help.
like those alpha blockers we talked about earlier.
Yes, sometimes the same medications used for BPH can help with retention. And in some cases, meds that help the bladder muscle contract more forcefully might be used.
Like giving your bladder a little pep talk.
You could say that. And if those treatments aren't effective, surgery might be necessary to address the obstruction.
Okay, lots of options.
Right.
Let's talk about urinary incontinence now.
Sure.
What are the different types and what causes them?
Urinary incontinence, the involuntary leakage of urine, can be distressing.
It sounds like it.
But remember, it's not a normal part of aging.
So there's hope.
Absolutely, it's treatable.
Okay, good to know. So what causes it?
Weak pelvic floor muscles, overactive bladder muscles, nerve damage, medical conditions, even some medications.
Wow, a lot of factors. What are the different types of incontinence?
We'll start with stress incontinence.
The most common one.
Yes, especially in women.
What is it exactly?
It's leakage that happens when there's increased abdominal pressure, like coughing, sneezing, laughing, or lifting something heavy.
I see. So a little pee sneaks out when you're straining. Why is it more common in women?
Pregnancy and childbirth can weaken the pelvic floor muscles,
Right.
and menopause can also contribute due to hormonal changes. In men, it can sometimes happen after prostate surgery.
So there are some gender-specific factors.
Sure.
What about that sudden urge to go? Is that a type of incontinence?
Yes, that's called urge incontinence.
Oh, right.
It's a sudden, strong urge to urinate, followed by leakage.
Like your bladder is giving you false alarm.
Exactly.
So it's an overactive bladder situation.
Right.
Okay, I understand that one. What else?
There's overflow incontinence. That's when the bladder doesn't empty fully, leading to leakage when it gets too full.
It's like the bladder is overflowing.
Precisely.
Okay, that makes sense.
This can be caused by an obstruction, like an enlarged prostate, or a weakened bladder muscle.
Okay, so a few different reasons for that one.
Right.
Rouse.
Then there's reflex incontinence, where leakage happens without any warning.
Oh, wow.
It's often linked to nerve damage.
So a miscommunication between the brain and bladder. What about incontinence after surgery or trauma?
That can definitely happen, especially in women who've had pelvic surgery or childbirth.
Okay.
And in men, prostate surgery can sometimes affect the urethra's control mechanisms, causing incontinence.
Got it. What about functional incontinence?
That's a bit different. It's not about the urinary system itself, but rather external factors that make it hard to get to the bathroom on time.
Like mobility issues or maybe cognitive impairment?
Precisely.
Okay, so it's more about accessibility and awareness than the bladder itself. How do doctors diagnose incontinence? Is it similar to retention?
The approach is similar. It starts with a thorough medical history and physical exam.
Okay.
A pelvic exam might be done to check those pelvic floor muscles and look for any structural issues.
Makes sense.
And yes, that voiding diary is helpful here too. A urinalysis is usually done to rule out infection, and the post-void residual volume test can tell us if the bladder is emptying fully.
Got it. So are there effective treatment options for incontinence?
The good news is, yes, many. And the best approach depends on the type and severity of incontinence and the individual's health.
So it's personalized.
Exactly.
That makes sense. What are some of the options?
Conservative management strategies are often a great place to start.
Like?
Things like cutting back on caffeine and alcohol, quitting smoking, managing constipation, and pelvic floor exercises.
Pelvic floor exercises, those are the Kegels.
Yes, exactly. Kegels involve contracting and relaxing those pelvic floor muscles to strengthen them.
I've heard of those, but I'm not sure I'm doing them right. How do you do a Kegel?
It's pretty simple. Imagine you're trying to stop peeing midstream. Those are your pelvic floor muscles.
Okay.
Contract those muscles, hold for a few seconds, and then release.
Squeeze and release. Got it.
How often?
Aim for a few sets of 10 repetitions throughout the day. You can do them anywhere, anytime.
Easy enough.
Huh.
What other therapies are there? I've heard of biofeedback. Biofeedback is great. It uses sensors to monitor your muscle activity and gives you feedback, helping you learn to control those pelvic floor muscles.
Like a personal trainer for your pelvic floor.
I like that. Electrical stimulation can also be used to strengthen those muscles. And for urge incontinence, bladder training can be really effective.
Bladder training.
Yes, gradually increasing the time between bathroom trips.
So you retrain your bladder to hold more.
Precisely. And there are medications that can calm those overactive bladder muscles and reduce urgency.
Okay, so a variety of treatments for urge incontinence. What about those anti-incontinence devices you mentioned?
There are a few. For women, there are pessaries, removable devices inserted into the vagina to support the bladder.
Okay.
And there are urethral plugs that block urine flow.
And what about for men?
For men, condom catheters can be helpful, especially when other treatments aren't suitable.
Okay, so kind of like a backup option. And finally, is surgery ever considered?
Yes, in some cases. For example, a sling procedure can support the urethra for stress incontinence. And for overflow incontinence caused by a blockage, surgery to remove that blockage might be necessary.
So it really depends on the individual situation.
Exactly.
Now, let's talk about a sensitive but important topic. Sexually transmitted infections, or STIs.
Okay.
What are they and how are they spread?
STIs are infections passed through sexual contact, and they can be caused by bacteria, viruses, or parasites.
Okay.
Some STIs don't cause any noticeable symptoms, while others can lead to various health problems.
And I understand that rates have been rising, which is concerning.
You're right. STI rates are increasing, which emphasizes the importance of communication, safe sex, and regular testing.
Absolutely. Let's talk about communication first, both between patients and healthcare providers and between partners.
Open and honest communication is so important when it comes to STIs.
I agree.
Healthcare providers need to create a safe space for patients to ask questions and share information without feeling judged.
So building that trust is essential.
Exactly. Avoid assumptions about someone's sexual history and use inclusive language. And between partners, honesty and transparency are key.
Right?
Partners need to talk openly about their sexual history, any potential exposures, and comfort levels.
It sounds like it's about creating a culture of trust and open communication.
Absolutely. And remember, STIs can affect anyone.
Okay, let's get into specific STIs, starting with bacterial infections. Chlamydia, gonorrhea, and syphilis. What are the key things to know?
Chlamydia is the most common bacterial STI in Canada, mostly affecting young adults.
Wow.
The tricky part is that it's often asymptomatic.
So people might not even know they have it.
Right, which is why regular testing is so crucial.
Okay, I understand that. What are the symptoms if they do appear?
Painful urination, discharge, and pain during intercourse.
Right.
In men, it can cause epididymitis, and in women, cervicitis.
What are those?
Epididymitis is inflammation of the tube that carries sperm, and cervicitis is inflammation of the cervix.
Got it. What if chlamydia isn't treated?
It can lead to serious problems, especially for women. It can cause pelvic inflammatory disease, or PID, which can lead to infertility.
Wow, so early treatment is essential.
Absolutely.
What about gonorrhea?
Gonorrhea is the second most common bacterial STI in Canada.
Okay.
And like chlamydia, it can be passed to a newborn during delivery.
So pregnant women definitely need to be tested. What are the symptoms of gonorrhea?
Similar to chlamydia, gonorrhea can be asymptomatic, but when symptoms do show up, they might include painful urination, a thick discharge, and painful or swollen testicles in men.
So some overlap with chlamydia. But are there any unique complications with gonorrhea?
Yes, if it's not treated, it can cause problems like prostatitis, urethral strictures, and even sterility in men.
Okay.
And in women, it can cause PID, Bartholin abscess, ectopic pregnancy, and chronic pelvic pain.
That's a lot of potential problems.
It is, so early treatment is really important.
Absolutely.
Definitely.
Okay, let's move on to syphilis. I know there have been reports about rising syphilis rates in Saskatchewan. What's happening there?
Syphilis rates have been skyrocketing there, and it's a major concern.
Why is it such a big deal?
Syphilis is a bacterial infection that can be really serious if it's not treated.
How is it spread?
Mostly through direct contact with a syphilis sore called a chancre.
Where do those sores usually show up?
Usually on the genitals, anus, or mouth, but it can also spread through infected fluids like blood or from mother to baby during pregnancy.
So multiple ways to get it.
Right?
Why is syphilis so hard to diagnose?
It's often called the great imitator because it can look like so many other diseases.
Well, that's tricky.
It goes through several stages, each with its own symptoms. The first stage involves the chancre, which is usually painless but very contagious.
So it might go unnoticed.
Yes, and that's why it spreads so easily.
Okay, so what happens after the first stage?
If it's not treated, you move to the secondary stage, which can involve a rash, fever, sore throat, swollen lymph nodes, and even hair loss.
So it starts affecting the whole body.
Exactly. And if it's still not treated, it enters a latent phase where there are no symptoms.
But it's still there.
Right, silently causing damage. This can last for years, but eventually it can progress to the tertiary stage, which is when things get really serious.
What happens then?
It can damage the heart, brain, nerves, eyes, and other organs.
Wow, that sounds scary.
It can be debilitating and even life-threatening.
So early detection and treatment are crucial.
Absolutely.
You also mentioned a link between syphilis and HIV. Can you explain that?
Having syphilis increases your risk of getting HIV, and if you have HIV and get syphilis, you're at a higher risk of complications from both.
So they make each other worse.
You could say that. That's why it's recommended to get tested for both at the same time.
Makes sense. Now let's talk about viral STIs. What about genital herpes?
Genital herpes is a common lifelong infection caused by the herpes simplex virus, or HSV.
Okay.
It's mainly spread through skin-to-skin contact during sex. There are two types: HSV-1, which usually causes oral herpes, and HSV-2, which typically causes genital herpes.
Okay. But I thought herpes was just cold sores.
Well, HSV-1 can cause those, but it can also infect the genitals through oral sex.
Oh, so you can get genital herpes from someone with a cold sore.
Yes, it's possible.
Good to know.
It is.
So what are the symptoms of genital herpes?
The first outbreak is often the worst. You might have flu-like symptoms, fever, headache, muscle aches, and painful blisters or sores in the genital area.
So it can really knock you down.
Yes, it can. But after that initial outbreak, the virus becomes dormant. Future outbreaks are usually less severe.
Okay, that's good to know. What triggers those recurrent outbreaks?
Stress, fatigue, illness, sun exposure, even your period.
Wow, lots of things.
There are.
Are there any long-term risks with genital herpes?
For most people, the symptoms are mild, but it can sometimes cause serious complications, especially in people with weaker immune systems.
So those with compromised immune systems need to be extra careful.
Exactly. It can spread to other parts of the body and cause problems like meningitis or nerve damage.
Meningitis?
Inflammation of the membranes around the brain and spinal cord.
Wow, definitely not something to mess with. What about pregnant women? Can it be passed to the baby?
Yes. If a woman has an active outbreak during childbirth, the virus can be transmitted to her baby.
So what do they do?
Doctors carefully monitor a pregnant woman's herpes status and might recommend antiviral medication or even a C-section.
To protect the baby.
Exactly.
Okay, that makes sense.
Yeah.
Now let's talk about the last STI on our list. Genital HPV, or human papillomavirus.
Okay.
What exactly is HPV?
HPV is actually a group of over 200 related viruses, some of which can infect the genitals.
200, that many?
Yep.
Wow.
And you know what? It's incredibly common. Most sexually active people will get HPV at some point.
Seriously?
Yep.
Wow, I didn't realize it was that widespread. What are the symptoms?
Well, like many STIs, it's often asymptomatic.
So you might not even know you have it.
Right. Many people clear the virus without ever knowing they had it.
Okay, so it can be a silent infection, What are the symptoms if they do appear?
Some people get genital warts, which are small bumps on the genitals or anus, but many clear the virus before those ever develop.
Okay, so it can fly under the radar. What happens if it doesn't clear on its own? Are there complications?
While most HPV infections go away on their own, certain types can lead to serious health problems like cervical cancer in women.
That's scary. Can HPV cause cancer in men too?
Yes, some types can cause cancers in men, though less common than cervical cancer.
What kind of cancers?
Penile cancer, anal cancer, and cancers of the head and neck, even throat cancer.
Okay, definitely not something to ignore. What can you do to prevent HPV and these cancers?
There's a very effective vaccine.
A vaccine?
Yes, it protects against the most common cancer-causing HPV types.
That's great.
It's recommended for boys and girls and works best before they become sexually active.
So vaccination is key.
It's one of the most important things we can do.
What if someone already has HPV?
For those who develop precancerous changes from HPV, there are treatments to remove those abnormal cells before they become cancerous.
So regular screenings are important.
Absolutely. Early detection and treatment are key.
So it seems like knowledge is power when it comes to STIs.
Absolutely. Safe sex, the HPV vaccine, and regular testing are so important.
This has been an incredible deep dive. We've covered so much ground today.
We have UTIs, kidney stones, BPH, STIs.
It's fascinating how interconnected all these aspects of genitourinary health are.
It really is. It shows how crucial a holistic approach to health is. What we eat and drink, even how we manage stress, can impact our genitourinary system.
I was really struck by how vital hydration is. I'm making 2 liters a day my new goal.
That's a great goal. Staying hydrated is a game changer for your urinary tract. And remember, even small changes in your bathroom habits or any unusual pain can be early signs of a problem. Don't ignore them.
So true. Early detection can prevent so many issues later on. And of course, we can't forget about open communication with our doctors and partners.
So important. It's all about working together to stay healthy.
I feel so much more empowered to take charge of my own genitourinary health after this deep dive. For our listeners out there, what's the one thing you hope they take away from our conversation?
Listen to your body. Pay attention to any changes, no matter how small.
Good advice.
Don't ignore those subtle signs, and talk to your doctor if something feels off. Early intervention can make all the difference.
That's great advice. So what aspect of genitourinary health are you most curious to learn more about now?
That's a good question. There's always something new to discover.
Maybe the latest research on UTIs or new treatments for incontinence?
Or
Or perhaps the social factors affecting STI rates?
there are so many avenues to explore.
Right.
Whatever you're interested in, keep learning and keep advocating for your health.
Well said. That wraps up our deep dive into the world of genitourinary health.
It's been a fascinating journey.
We hope you found it informative and empowering. Remember, taking care of your genitourinary health is crucial for your overall well-being.
And knowledge is key.
Thanks for joining us.